Diagnosis and management of multiple polyposis coli. Multiple polyposis coli refers to the presence of numerous polyps in the colon, often associated with hereditary conditions such as familial adenomatous polyposis, F.A. Peutz-Jeghers syndrome, or juvenile polyposis syndrome. Early diagnosis and effective management are crucial due to the high risk of malignant transformation in some of these polyps. 1. Diagnosis. The diagnosis of multiple polyposis coli involves a combination of clinical evaluation, imaging studies, endoscopic procedures, and genetic testing. A. Clinical history and examination. Family history of colorectal cancer or syndromic features. Symptoms: rectal bleeding, diarrhea or constipation, abdominal pain, mucus discharge, extracolonic manifestations, e.g. desmoid tumors, osteomas, dental abnormalities in FAP, mucocutaneous pigmentation in Peutz-Jeghers syndrome. Endoscopy, colonoscopy, direct visualization of polyps in the colon and rectum. Number, size, and morphology of polyps are noted. Biopsies are taken for histopathological evaluation. Upper GI endoscopy to evaluate for gastric or duodenal polyps, especially in syndromic cases. C. Imaging studies, CT or MRI colonography for comprehensive visualization of the colon and extracolonic structures. Abdominal ultrasound or MRI to detect extracolonic tumors, e.g. pancreatic or desmoid tumors. D. Histopathology. Biopsy specimens help distinguish between adenomatous, hamartomatous, hyperplastic, or inflammatory polyps. E. Genetic testing. Identifies mutations associated with hereditary polyposis syndromes. FAP, APC gene mutation. Peutz-Jeghers syndrome, STK11 mutation. Juvenile polyposis syndrome, BMPR1A or SMAT4 mutations. Recommended for patients with a significant family history or syndromic features. 2. Management. The management approach depends on the underlying cause, number of polyps, risk of malignancy, and associated symptoms. A. Surveillance. High-risk patients. Begin colonoscopic screening in adolescents for FAP and juvenile polyposis syndromes. Repeat every 1 to 2 years based on polyp burden and size. Peutz-Jeghers syndrome. Routine endoscopic and imaging surveillance for GI and extracolonic cancers. B. Medical management. Nonsteroidal anti-inflammatory drugs, NSAIDs, e.g. Solindac or celecoxib to reduce adenomatous polyp burden in FAP. Hormonal therapies. In specific syndromes, for example, tamoxifen for estrogen receptor-positive desmoid tumors. C. Endoscopic polypectomy, used for manageable numbers of large or symptomatic polyps. Regular follow-up is necessary to monitor for recurrence. D. Surgical management. Indications: high polyp burden, large or high-grade dysplastic polyps, failure of endoscopic management. Symptomatic complications, e.g. obstruction, bleeding. Surgical options: prophylactic colectomy, total proctocolectomy with ileal pouch anal anastomosis, IPAAA, for FAP, subtotal colectomy with ileorectal anastomosis in select cases. Segmental resection in non-syndromic polyps or less aggressive cases. Post-surgery, ongoing surveillance of the remaining GI tract is essential. E. Extracolonic manifestation management, treatment of extracolonic tumors, e.g. desmoids, thyroid, or pancreatic cancers, as per standard oncology protocols. F. Genetic counseling, offered to patients and at-risk family members to discuss inheritance patterns and screening strategies. Prenatal testing or pre-implantation genetic diagnosis can be considered in families with known mutations. 3. Follow-up. Regular follow-up is essential for all patients with multiple polyposis coli due to the high risk of recurrence or progression to malignancy. Follow-up strategies include periodic colonoscopy or sigmoidoscopy, imaging studies based on individual risk, monitoring for symptoms suggestive of complications or extracolonic cancers. Prognosis. With early detection and proper management, the prognosis for patients with multiple polyposis coli improves significantly. Timely prophylactic surgery, regular surveillance, and genetic counseling play critical roles in preventing malignant transformation and improving quality of life.